Welcome to The Real Heal, a show featuring real, raw, and authentic conversations between experts in the holistic health space. I am your host, Dr. Renee Wallenstein, also known as the Libidoologist, double board certified doc, entrepreneur, as well as healthcare disruptor. So if you're ready, let's get into it. All right, so welcome to the very first monthly Q&A here on The Real Heal. And this month, we're actually going to focus on libido, low libido in women. And, I actually have multiple posts on TikTok regarding libido, low libido in women, and lots of questions. And one post in particular has like 80 some comments with women talking about their low libido. Now, here's the thing. If I start putting these questions on Instagram or TikTok, I need you to be really specific, because when you just tell me you have zero libido, it's really hard for me to sort of discuss what might be going on. Now, a little disclaimer before we get into all of this: every woman is different. Libido is a huge topic in women. There can be many underlying reasons why a woman has low libido. And so what I'm going to do is I'm going to touch on actually 3 questions or comments that were made and kind of riff on them, discuss them. However, I don't think I'll be able to cover every little nuance in every part of the question or comment, but I'm going to do my best, just try to hit the high points and actually give you something to think about if you resonate with any of these comments / questions that other women had commented on or posted on my TikTok. If you are not on TikTok, come on over to the dark side of TikTok and find me, Dr. Renee Wallenstein. I'm also on Instagram, Dr. Renee Wallenstein. However, I have a very engaged and interactive audience on TikTok when it comes to the topic of libido. So, and I have a feeling I'm going to alternate the Q&As, but right now we got a ton of questions on libido. So we're just going to go with that, and maybe we'll do another one again next month. So first question I received from a follower on TikTok was, I can't focus in the moment. I'm always thinking of something else. I get so distracted. Okay, so I hear this a lot from women. And 2 things I automatically think about when a woman tells me that she can't focus on the moment are stress and mindfulness. And there could be a lot of other things going on. However, those are the 2 that come to the forefront of my brain. And when I work with women, 2 of the biggest things that they are dealing with is stress and pretty much living in the moment. Many women are living in the future or in the past. We live in the past or thinking about the future, and that takes them away from the moment. So, number 1, stress plays a huge part here. And, what many of the women I work with and are on TikTok and Instagram and commenting all the time about low libido, they're always talking about how much they have to do in a day. They're overscheduling themselves and they're not asking for any help, which leaves them feeling completely overwhelmed. I get this. I was that superwoman in years past who also thought I could do it all and not ask for help. And that just got me burned out. And so I think a lot of women are on that verge of burnout, but when we're in the scenario that she can't focus in the moment, she's thinking of what she has to do as soon as she's done being intimate with her partner, or what she didn't do, or where are the kids, or what are they having for dinner, or what she forgot at the grocery store, or the emails that she didn't send, or the email she has to check, or the TikTok she has to create when she gets done, right? So like all of these things are on her mind and she can't focus. So number 1, mindfulness kind of comes in there because, again, she's already living in the future of what she has to do when she quote unquote gets done with being with her partner, or what she didn't do. And so, focusing on your body, focusing on staying in the moment and staying present and enjoying, and, focusing on all the different sensations and smells and noises. Hopefully there's not too much noise except for what you're making. And, looking in your partner's eyes or what they're doing, doing your best, and it comes with practice of just staying in the moment and knowing that once you are finished, you can go back to doing whatever you were thinking about before and doing. But when you're in that moment, really focus. And again, it's like a muscle that has to be exercised, right? You have to practice being mindful and being in the present moment. And here's the other thing, try not to squeeze it in between things, right? Because that's only going to lead to distraction. When you have to, in 10 minutes, you have to get on a call. You're going to be like, okay, let's go. You're going to be like, okay, are we done yet? Right? No, you want to be intimate, or try to, even if you have to, like, I don't want to say schedule it, because that takes the spontaneity out of it. But there's some parents out there that you actually have to have a time where the kids are not around, or the kids are sleeping, or what have you, that you can actually be intimate, because that's another thing that can distract, especially mamas out there. If the kids potentially can walk in, or the kids are roaming around the house, you want a time where you can relax. So looking at your schedule, again, we're adults here. A lot of times it cannot necessarily be spontaneous, and it has to be like, okay, when am I going to be most relaxed? When can I be most in the moment? And try to aim for that time. Okay. But let's go back to stress for one little bit. We were talking about women overscheduling themselves. I've talked a lot about stress on my social media, and I often talk about the ABC method. And what I mean by that is A is awareness. Like, what are you stressed about? Right. I think when we run around just saying we're stressed, about what? Because you can't change something unless you know what you're stressed about, right? You can't do anything about it unless you know what the problem is. Number 2, boundaries. Just say no. You can't always put 10 things on your list when realistically you can only get 3 things done. All right. So stop saying yes to every PTA meeting, every committee at school, taking your friends everywhere, taking your kids everywhere. Just say no. Start setting boundaries. Okay. Believe me, if you can't do it for someone, they'll find somebody else. And if they don't like it, too bad. We're talking about your mental health here. You're talking about keeping you in the long game of stress management and stress resiliency. And it comes with saying no. Okay. And C is communication. I was going to add a little bit more about boundaries, but we'll add it in with communication. Telling your loved ones what you need, including your partner. And I'm not talking about in the bedroom, because there's a place for that as well. But I'm talking about, we can't even get you present in the moment in the bedroom because you're so present about what's going on outside of the bedroom. So communicate what has to get done. Do you still have to go to the grocery store? Is that on your mind when, and keeping you from being in the moment when you're intimate? Ask your partner, like, hey, can we tag team this? Can you go to the grocery store? I'll start dinner, right? Or can you help the kids with homework so I can start dinner? One less thing on your plate will help you focus in the moment, because you're actually taking a little bit of stress off your plate as well. Okay. Again, we're not super women. You can think you are, but at the end of the day, you're not going to get a trophy. You're just going to fall in bed exhausted and not having enough energy to be intimate, or any desire to be intimate because you're so exhausted. Okay. So the 2 things that might be taking you away from being in the moment is not being very mindful in the moment. So again, living in the past or the future of all the things you have to do or didn't do. Ties in a little bit with that stress. And remember, ABC, what are you stressed about? Where can you say no? Where can you set boundaries? And where can you ask for help? Right? Because a lot of times, women, I talk to women all the time, every day, and they feel like they have to do for everyone else to prove that they're good enough, that prove that they're worthy, to prove they're a good enough mother, a good enough wife, a good enough employee. You don't need to prove anything to anyone. You don't need to prove your enoughness, if that's a word. You are enough as you are. You do not need to prove that you are enough by doing for everybody else at the expense of taking away from yourself. Okay. Excuse me. Question 2. I'm getting all riled up here. I'm getting all like coughed in my podcast mic. I'm sorry. Number 2, getting in the mood is another comment. Quote unquote, getting in the mood. Once I'm in it, then it's great. It's just getting there to begin with. It seems like a chore to get started. You're going to find out in these 3 questions or comments, there is a through line here of stress. Okay. And energy. And here's the thing. A lot of women look at being intimate as a chore. It's going to take energy. It's energy consuming. And I don't have a whole lot of energy to begin with. I get that. I get it. But it's how you frame the act. Okay. Is if it looks to you, and again, her comment was when she gets into it, she has a great time. It's great. It's just getting started. So, I want you to visualize like how you, and be present, comes back being present. Like when you're in the moment and you have finished it, or you're in the moment and it feels good and you're like, oh my gosh, why don't we do this more often? I want you to remember what that feels like. So those times when you are like, oh, I just got to get into it, know that when you remember what it felt like when you were into it and how it felt. Okay. Many women, they can't seem to get in the mood because they think it's like, it's going to require all this extra energy. And again, one of the most relaxing things that we can do is have sexual activity with a partner, have an orgasm, huge stress relievers, and very relaxing. So it's just a matter of taking the mindset of it's going to require a lot of energy or it's a chore. Reframe that. It's not a chore. It's something that you really enjoy, because remember how you feel once you get into it, and just visualize how you're going to feel once you start getting into it. Okay. And take that mindset of a chore energy out of it. Okay. Because again, I hear this from a lot of women in this comment. Exactly. It's just, gosh, and they're in the moment. They're like, why don't we do this more often? Well, you're the one that said you didn't want to do it more often, right? So stop, and I don't like the word stop. Try to reframe it and look at it as something that's really like a great stress reliever, a great break in your day, very relaxing. And if you don't have an orgasm and it's one-sided, well, that's a whole nother issue. And I take it from this comment that that's not the case, but believe it or not, I have had women approach me at parties and say, they have a lower desire because they never get, maybe 10% of the time they get pleasure in the bedroom or pleasured. And we quickly worked on that. And it's amazing that once, you reframe like, okay, this is not all about you. This is about both of us and our experience and our pleasure. And you make your partner aware of the fact that you are concerned that you're not getting pleasured, and put it on his quote unquote to-do list or hers. It's funny how when they make that like, oh, my goal is to have you also have pleasure, how your libido will just skyrocket, right? Because now you're actually entering the bedroom and you're both getting pleasure as opposed to just it being one-sided. And again, I guess I was naive to think that some women were actually entering the bedroom and not getting any pleasure. It was all about their partner. And I had this brought to my attention, and I was like, of course you don't want to enter the bedroom, especially if you see it as a chore, because it's all one-sided. Okay. So that comes down to what we already talked about when it came to stress, the communication part in the bedroom. If you're not communicating your needs in the bedroom, that is on you. Okay. You need to communicate what you want in the bedroom, what is not serving you in the bedroom that may be actually prohibiting you from wanting to enter the bedroom. So that communication is key both inside and outside the bedroom. And the third question or comment was a big one. She talked about dryness, exhausted, and she was diagnosed with PCOS by one of her doctors 13 years ago, like a random doc. So we got a few different components to this comment or question. Number one, the dryness. Dryness is huge. So let me start by saying, if you have vaginal dryness during sex and it hurts, you're not going to want sex. It's a no-brainer, in my opinion. So we have to figure out why you have dryness and do something about it. Okay. When I say figure out, it could be a simple, straightforward, I'm menopausal, my estrogen is low or non-existent, therefore I have vaginal dryness, because the vaginal tissues in women are very responsive to estrogen. So when we lose our estrogen, or I shouldn't say lose, that sounds very dramatic. When our estrogen levels are very low in menopause or fluctuating and lower in perimenopause, you could experience just inherent vaginal dryness from the hormone deficiency. The other issue, it could be a hormonal imbalance, and maybe you're not even perimenopausal. You could be postpartum. That's another sign. That's another situation whereby the estrogen could be lower, especially if you're breastfeeding, or it just could just be a hormonal imbalance, period. Okay. That's causing your estrogen to be a little bit on the lower side. Another scenario would be lack of foreplay. If you are in one of those relationships where you're just like, okay, let's go now, hurry, 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 and there's really no getting the engine started, you could potentially be very dry, and that's going to hurt because your tissues are just not ready to accept a guest just yet. Okay. You actually need time. You need, and for women, it comes down to a lot of times, as we talked about in the first question, with that being distracted and not being in the moment, she is not focused on what's going on in the moment. So we need to sort of get her out of her head and into her body and what's going on. And that a lot of times, this goes out to my gentlemen out there. This doesn't happen in a minute. A lot of times. Okay. Unless she's meeting you at the door, ready to escort you into the bedroom, she needs a little time to get out of her head and a little time to relax. And that some days it could occur faster than others. And, I think when women put a time frame on, like, oh my God, like we've got to be done in 5 minutes and 10 minutes, and we get in our heads again, and we're putting a time limit on it. And then that's a libido killer right there. Like that's a lubrication killer. So, really taking the time for that adequate foreplay, kissing, touching, talking, maybe undressing each other, like just having fun with it, just that anticipation of the moments will do a world of good for women and men, of course, but we ladies, we need some extra time. Okay. So it could be hormonal, or it could just be lack of adequate prep time. Let's put it that way. Okay. So what are the options when it comes to dryness? Well, there's a few different options. What I would really love to let's knock the most obvious one out of the park right away. And if it's a lack of foreplay, that's an easy enough fix. You don't need anything else. You don't need lubricants. You don't need moisture. You don't need anything. You just need extra time getting ready and getting prepared for your guest, right? So I feel like right there, if you identify, listen, I just need, and again, it comes down to communication. If you're not lubricated because you're not, you're in your head, you just need more time getting out of your head, communicate with your partner that that's the case, and you just need a little more time. Right? A little more kissing, a little more touching, a little more, whatever you need to communicate that. Now, on the other hand, a lot of times if you're menopausal, that's a no-brainer as well, right? I stopped getting my periods for a year. I'm considered menopausal. Most likely your estrogen's on the lower side. So in that case, you could, I have a lot of women on my social media saying, I can't take hormones. If you can take hormones, vaginal estrogen is wonderful. It's localized. There's lots of different preparations. There's bioidentical estrogens, meaning more natural estrogens that you can put in the vaginal tissues. It helps prevent urinary tract infections, which are very common in women that go through menopause, just because all of our vaginal tissues are very responsive to estrogen. Okay. And that's the other thing when it comes to menopausal states. If you don't use it, you lose it, meaning we want to make sure that we're continuing to use our vagina for sex or getting dilators or something that you actually have penetration, because your tissues can actually get smaller and more atrophied or and thinner if we don't consistently pay attention to them and nurture them. And whether that be, if you don't have a partner, then there's self-pleasure, there's masturbation, there's lots of ways around it if you don't have a partner. But, and there's a lot of women on my social media saying, I know if I don't use it, I'll lose it, but I don't have the desire. And that's what we're getting at here, because if it's dry, let's do something about that so you can use your vagina. So again, vaginal estrogen's wonderful if you're menopausal, and you can use estrogens, especially the more bioidentical, the estradiols, creams, tablets, you have all different kinds. And again, you have to go based on your preference. You have to talk to your doctor. I am not your doctor, but there are different preparations, and different people, like, they don't like the creams because they're messy or this or that. You don't use the creams when you're going to be intimate. You use it on nights that you're not going to be intimate. There's a whole set of guidelines around use of vaginal hormones, but if that is an option for you, just know it's out there, and you just have to talk to your doctor about it. Okay. And let me just discuss quickly, a lot of gynecologists are against hormone replacement. We're not going to get into that topic right now. However, many are agreeable to vaginal estrogen, since it's usually a lower dose and it's very localized, and it's used for treatment of vaginal tissues that have lost their estrogen. Okay. And then, there's other things. If you can't use hormones, there are lubricants that you can use in the moment, and there's actual vaginal moisturizers as well. And again, it comes down to, potentially talking to your doctor about dilators. Maybe things have gotten smaller, and maybe you want to get things a little more opened up. We have dilators you could use, so like and there's vibrators. There's things that you can use to make sure that you keep using the vaginal area for, in case you're between partners and you're not currently active with a partner. Okay. In this comment also, with dryness, she was also exhausted. So again, exhaustion can be for many reasons. We can go back to the first question, which was about stress. She could have a hormonal imbalance, namely with cortisol, because of stress levels. Remember, women, and again, we're not going to get into a gender war of like who does more in the house, but women, we wear a lot of hats during the day, and we're doing everything for everyone. So again, we're coming down to our ABCs that we talked about earlier in the show: awareness, boundaries, communication around your stress. Where can you say no? Where can you ask for help? Okay. And I have a lot of times our stress levels being so high, it's leaving little time for ourselves, let alone, time for intimacy. So, and energy. So there's that. You can also have just an underlying hormonal imbalance. You could have, aside from the female hormones, you could have a thyroid issue that is leading to low energy. Again, this is not an episode on thyroid, but we could talk about thyroid in the future. But if you suspect maybe you have a thyroid condition, you might want to see a functional medicine provider, because they're going to actually check more than just a TSH to see if a thyroid condition is the reason why your energy is so low. And a third one I can think of off the top of my head for exhaustion is a mitochondrial dysfunction. Now, we don't talk about this a lot. It's kind of cutting edge. We're talking more about mitochondria. But you can have primary, secondary mitochondrial dysfunction. We're taking primary off because that's like genetic reasons. And generally, you have an issue with your mitochondria if you have a genetic disorder. However, secondary could be things from toxins or chronic diseases. So you want to keep that on your radar when you're like, well, I don't have any stress and I think my other hormones are okay, or I've had them checked, quote unquote, checked, and they're fine. Think of mitochondria. Like, think of like the zebra in the room, right? And it's not so much of a zebra because it's much more common than we think. There are markers. One of the biggest ones I used to see, or actually test for, is CoQ10. And it's an enzyme. It's a mitochondrial enzyme. And a lot of times it will decrease as we age. And then also sometimes with medications. And the most common medications I would actually see it get depleted with are statins. So if you're on medications for cholesterol. A lot of docs nowadays are actually giving you the supplement CoQ10 if you're on a statin, or sometimes beta blockers like propranolol and metoprolol, or antidepressants can all do it. So, when we talk about exhaustion, it's a big can of worms that we're opening, and it can range everywhere from stress, which can affect hormones, whether it be female hormones, thyroid, or even insulin, or even a mitochondrial problem. So there's a whole slew of underlying reasons for exhaustion. And there's more. There's infectious diseases. There's a lot more that we're not going to get into. I'm just giving you like the key heavy hitters that I see with women. And the last part of her comment was about PCOS. And, polycystic ovarian syndrome, I know it sounds awful. It sounds like some sort of cancer. It's not. It's a condition whereby women usually present with irregular periods. Maybe they're not getting their periods. And, it's, I'm sorry, I got a comment on TikTok, and I'm not going to read comments on TikTok. Usually it's an issue with irregular periods, no periods, can't get pregnant, and generally some insulin resistance, usually some weight issues, maybe inability to lose weight. There's a whole slew of like common symptomatology that goes with PCOS. They used to say, oh, you need an ultrasound and this ring of pearls on the ovaries. And it's more of a clinical diagnosis now, which it sounds like in this case it was. It's like, okay, you have these symptoms. Many times they will check hormone levels, but a lot of times docs will be like, you kind of have all the symptoms. You probably have PCOS. And, it causes a deficiency a lot of times in the female hormones and an excess of what they call androgens, which are the male hormones. So if you're out there and they're like, men have lots of testosterone and they have great libidos, men and testosterone equals a great libido. It's not the same for women. And it actually, normal physiologic levels for women, testosterone, are much lower than men. And when we have an excess of androgens, it actually can be, it can impair our libido. And so it also causes the weight gain, which does prevent women from feeling good about their bodies. It can cause abnormal hair growth, which again, women, we have the societal norm of what we're supposed to look like. And when we don't fit that, we feel lesser than. And so that many times can affect our libido, unfortunately. So, unfortunately, PCOS, not only the hormonal imbalance, but a lot of the sequelae that comes with it, including the weight issues, can be problematic when it comes to our libido. And, a little end point to the PCOS talk is a lot of times docs will put you on the birth control pill to bind up the extra testosterone, also known as an androgen. The problem is, yes, it may help lower testosterone, which will help potentially lower, hair growth. It certainly won't allow you to get pregnant because it's a birth control pill. It certainly won't normalize your female hormones because we're suppressing your hormones as it is. It just kind of puts a Band-Aid on some of the symptoms, including a lot of times acne and the abnormal hair growth. But birth control pills will actually contribute to a low libido because specifically for binding up that testosterone. I mean, it's a double-edged sword. It's used to do that. However, in doing it, it also will contribute to a low libido. So, PCOS, a lot of times it is just nutrition related. A lot of times nutritionally, if you can intervene with your diet, weight loss, you will get your hormones better under control, as opposed to taking just pills or hormones for masking the symptoms, and get your periods back, reduce your hair growth, your acne, your weight gain, and improve your libido. So that's what I have for you today. Those 3 questions. I'm sorry. I've tried to multitask when I do these. I'm recording a YouTube. I'm also on a TikTok and doing the podcast. And so I hope this was helpful. If you have any questions, come and find me on any of my social media platforms, TikTok, Instagram, Facebook, Dr. Renee Wallenstein, across all platforms, YouTube. And let me know if you don't feel comfortable commenting. You can always DM me, message me, private message me, whatever way you want. And I will try to get to your questions. But I am so excited to do a monthly Q&A for you. And again, this month was libido. Perhaps next month, if it's backed by popular demand, I will talk about libido again, since it is a hot topic across all the social media platforms. And I do my best. Libido in women is very complex, and I try to hit on the key points. And without any woman feeling like it's abnormal of them to have a low libido. I don't want women to feel like, oh my gosh, I have no sexual desire. Something must be wrong with me. And if you have a low desire and it's not bothering you or your partner, then there's nothing we have to do about it. But if it is interfering with how you feel about yourself, or it's interfering with your relationship, then maybe we should look into things. And the reason I talk about a lot of these topics is because they're not easily fixed with the next best pill or even hormones, because being a gynecologist, working with women for over 20 years now, I have seen all sides of a low libido in women, and I have tried all the things and they didn't all work. And so I'm here to say there's more to it than just a pill or hormone. And it could be I'm not saying the pills could be part of the solution, because a lot of times there's more than just that to deal with. Hormones might be part of the problem, but a lot of times for women, it's, it can be psychological and physical. So we have to address both. All right. So I hope this was helpful, and look forward to coming back next month with another Q&A in December. And if you have any burning questions, feel free to message me and I will try to get them on the queue and answer them. All right. Thank you. We will see you again on the Q&A next month. Well, I hope you enjoyed this episode of The Real Heal and that you learned something new. And before you go, can you do me a quick favor? Take a screenshot right now and share it to Instagram and tag me so I can celebrate you for taking action and improving your health. And if you're enjoying this podcast, please take a minute to leave me a rating and a quick review. This will help others just like you find the show. And do not forget to subscribe, because you will not want to miss out on any of the amazing guest experts that I have coming up very soon. And remember, it's not selfish to take care of yourself. Do one thing today that makes you happy and learn to love life again. And with that, I'm out of here. Talk to you again soon.